Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, here to take some questions that we've received about senior cats, one of my actual favorite topics. So I've got my assistant Alex who's going to ask me some questions about senior felines.
Dr. Lucas, how will getting older impact the health of my cat?
Well, unfortunately, as we all get older, and your cat gets older, they are more predisposed to senior feline health diseases. So we're going to talk about some of those, but because aging in your cat is going to make them more predisposed to acquired diseases, we as veterinarians really want to see your older feline, ideally every single year, sometimes every 6 months, so that we can keep a really extra close eye on them as they age.
How do a cat's nutritional needs change as they age?
Well, senior feline cats often are just a little bit more sedentary, so they're a little bit more predisposed to weight gain. And as they are gaining some more weight, they're putting more stress on their orthopedic system and their hearts. So really, as a cat ages, we're going to be more mindful of their weight gain, and so we might want to start reducing their calories. They might have some GI distress or GI disorders that might be acquired as they get older, so we might want to change their diet to maybe having more fiber. So really it just kind of depends on how your individual cat is aging and what nutritional needs that they may have.
What are some signs and symptoms that your cat's probably slowing down with age?
Yeah, so cats are really sedentary already. However, as cats are slowing down, they often aren't grooming themselves as well. So one of the things that you may notice first is just, we call it that unkept hair coat. Just looks a little bit more matted together, not as smooth and silky. That can indicate that your cat is having a hard time just maneuvering its little body to groom and lick itself. So unkept hair coat. You may have noticed that your cat could maybe jump up to a higher surface when they were younger, and you've kind of slowly forgotten that they could make that jump earlier in their lives, but as they've aged, you start putting maybe a little side table up next to it. Now they're jumping on the side table to get up to the countertop, so they're taking more levels to get to the place that they want to get to. Just slowing down. You might see them going up and down steps, but instead of doing a real quick trot up and a real quick trot down, which is normal, now they're just taking one step at a time, and it's just a little bit more labored and it takes them more time to move. So, jumping concerns, grooming concerns, maybe they're not making it all the way into the litter box. Maybe they're making it to the litter box, but they just go potty on the outside of and soil around the litter box can indicate they're having trouble actually getting in and out of the box. So if you suspect that your cat is maybe having some uncut hair coat, or just not able to just get into the places they used to without having to take lots of levels, or maybe they're missing some of their litter box potty times, you probably should be talking to your veterinarian.
What are some common health complications and diseases that senior cats get?
Yep. So senior cats, we know that as they age, they're just going to potentially develop one of those senior feline cat diseases. Absolutely number one would be chronic kidney disease, or we call it CKD. So kidney health starts declining, and we can detect that through blood work. We see thyroid disorders happening. So cats always get high thyroid, so hyperthyroidism. They get little goiters or little nodules of their thyroid glands, and their thyroid hormone goes up. And so we will see that in older cats. Diabetes, they do get diabetes, and we'll see that as a senior feline disease. We talk about feline heart disease or cardiology concerns, so acquired heart murmurs because the valves start to age. We'll get electrical abnormalities sometimes. We'll get gastrointestinal diseases like inflammatory bowel disease, or maybe even some cancers like lymphoma in the gastrointestinal tract, or just cancers in general are more likely in the senior feline. So I'm just trying to run down my big cat diseases. Those are the most common that we'll start to see. And then finally, don't forget musculoskeletal diseases like osteoarthritis, so just arthritic bone.
What kind of preventative care can extend the life and health of the cat?
So if you have a cat that's getting older, we want to get their weight down, or at least weight appropriate. We want to try to keep their muscle mass strong. So preventative measures could be just dietary calorie restriction to maintain a leaner body mass. We know cats need to keep their muscles just like we do as we get older. So doing more, play with them, and just laser lights and little fishing poles and, little interactive toys to keep their mind sharp and their muscles moving is a good idea. Brushing them more potentially if they're having some problems grooming themselves. So just having, that routine grooming behavior and get good brushes. So some of these things can just help keep your cat's hair coat good, keep them up and moving, keep their weight in check. Oftentimes, just nutritionally, I'll start maybe switching some older cats over from maybe dry diets into canned foods if they'll eat it. Canned nutrition has less calorie density, so just by making that one simple change from a primarily dry diet into a canned diet drops their calories down, and they'll start to maybe even lose a little bit of weight because they're eating more water density in that canned food and dropping weight.
What test might a senior cat need?
So by far the most important test that your senior cat needs is an exam by your veterinarian. Hands, eyes and ears, when we listen to hearts and we touch your cat and we look at them, that's by far one of the most diagnostic tests that we can do as veterinarians. And then that's a good outside check, I call it. And then the blood work that we want to recommend or run on your older cat is so we can kind of look at those internal organ functions and look at those kidneys and look at that blood sugar and look at the liver and look at the thyroid, and look at their urine, look at their cardiac enzymes. So we're taking a pulse or a check on all those things internally. So your veterinarian's absolutely going to want to run some blood work on your senior cat.
What's the most important thing we need to know when you have a senior cat? Just one big thing.
So I guess, what age do they become a senior? So that's a good starting point. Generally, cats are known to start their senior years. It's kind of a sliding scale, maybe 8 to 10-ish. That's kind of my senior time, where they'll kind of transition from adult to senior. By the age of 10, they're truly a senior, and then maybe till they're age 14, 15, we'll start to get into their geriatric years. So as we transition into that later part of their life, they still should be very active. I had a cat to live to be 22, and she had a very happy, healthy life up until about 20. And then it started to get a little bit, age-related changes started to be known. But your senior cat needs to, most important, see their veterinarian at least once a year, because we're going to find those things that they like to hide. Cats are very secretive about their diseases, and we know they're more prone to get senior feline diseases at the age of 10 and older. So we really encourage you to come see your veterinarian with your senior cat at least once a year, getting them a good physical exam, getting them some blood work. We're going to be able to find some of those diseases early, so that we have the most opportunity to change their diet or partner with you to find some additional tests, so that we're able to slow the disease down and or cure it. This thyroid disease is curable. So we as veterinarians really train hard to help you with your senior cat. We love them. They are near and dear to your hearts, as my senior cat has been to me. So please see your veterinarian with your senior cat, so that we can partner with you to let them live a long and healthy life. Thanks so much.